And I do research in high functioning depression. And from what you're saying, you were a young mother dealing with grief, working. What did you pull on to cope adaptively? What were the things that you held on to that helped you?
First of all, therapy. Therapy is just, I can't tout it enough. Even if you think everything is okay, you get a wellness check for your physical body. Why wouldn't you do a wellness check on your mental health? One of the things that I did, especially as a new mother, is I set up a postpartum anxiety and postpartum depression therapy session before I gave birth. I found and set that up to anticipate that. And then 2 weeks after I gave birth, before everything started I was already in therapy, a virtual therapy appointment. I was already in it. My husband and I have talked about things like couples therapy to help navigate new things, navigate new parenthood, transitions, life changes, even though, like, you know, marriage might be good. I think, nothing's falling apart. And one of the things that I said is I feel like there's this focus on birth and birth plans and birth preferences, which is great, very important, but there's not enough postpartum planning. And I planned for postpartum more than anything else. And I'm so glad that I did. Everything from, physically, pelvic floor therapy and all of those things, because I did the research about it, but also I picked a pediatrician that had a lactation consultant on site because I didn't want to have to go out and find one if I was struggling. Because when you're in that space, having my therapy set up, knowing that when it was time to wean my son, that's another hormone drop that can cause a whole other wave of anxiety and depression that you have to get over that bridge. And so really trying to learn about postpartum, which is not just 6 weeks after you give birth. It lasts longer than your pregnancy.